If you've ever been confused by words like liposarcoma or adenocarcinoma and want to know what they mean, then this video is for you. On the left is a stained image under a microscope showing a hepatoblastoma. But what does that even mean? Despite these confusing names, the good news is that many cancers fall under a naming system that can actually be pretty useful once you get the hang of it. Once you learn the system, you can tell a lot about a cancer just by the name. The National Cancer Institute also has a great guide for this cancer classification system, which I'll definitely recommend for everyone to check out, and I've included the link in the show notes below. So let's get started with some of the basics. There's actually two ways of classifying cancer, and the first way, by primary site, is pretty much common sense, so we're just going to gloss over it. The second system, by histological type, is what's more confusing, but it's what medical professionals and scientists use to communicate more detailed information to one another. Histology basically refers to what cancer cells look like under a microscope, and that'll be our focus for today. So just glossing over classification by primary site. If you know what lungs are, then you know that lung cancer refers to cancer of the lungs. There's no surprise there. Same with breast cancer or colon cancer, or any of these other examples which you'll commonly hear referred to in the public sphere. The only additional thing I should say to keep in mind with primary site is that it's referring to where a tumor originates. Not everywhere a tumor might have metastasized to. So for example, a cancer that originated in the breast but spread to the liver would be called breast cancer. In fact, it would be called metastatic breast cancer. But it wouldn't really be called liver cancer or a hepatocellular carcinoma or anything like that. The goal of learning this histological nomenclature as a classifying system is to know the difference between an adenoma and an adenocarcinoma. What's the difference between a leiomyoma, a leiomyosarcoma, and a rhabdomyosarcoma? That's what we're trying to get to. Unfortunately, there are some Latin and Greek prefixes that you just have to memorize. Good news is you may already know a bunch of these depending on your background. So if you know what osteoporosis is, you could probably guess that the prefix osteo refers to bone. Some other examples are hepato, meaning liver, melano, as in the skin cancer melanoma of pigmented skin cells, or myelo, referring to bone marrow. And once you figure out these prefixes, you can name many different types of tumors. I also want to emphasize that these rules are not universal and don't work for all types of tumors or cancers. But if we're talking about a benign or non-cancerous tumor, it will usually be followed by the naked suffix oma, just oma after the prefix. So a benign mass of blood vessel cells would be called a hemangioma. So these are some exceptions. So for example, seminoma and mesothelioma are both examples of malignant tumors. So think of this more as a rule of thumb than a hard rule. Now, malignant tumors share these same prefixes, but they're usually followed by either the word carcinoma, sarcoma, or blastoma. We'll get to what these mean, but I again want to emphasize that there are other malignant cancers that don't neatly fit in here and have different naming systems, like myeloma, leukemias, and lymphomas, for example. So what's a carcinoma? This is a neoplasm or abnormal cell growth of epithelial origin. Epithelial cells are the cells that line the internal and external lining of the body. They can line skin, blood vessels, organs, and other body cavities. Carcinomas are the most common type of cancer, representing about 80 to 90% of cases. This is thought to be for at least two reasons. If you think about epithelial cells being the cells that face the outside world, they're more exposed to carcinogens that can cause cancer. So looking at the image to the right, those epithelial cells lining the airway are directly interacting with anything in the airway and so are more exposed to inhaled carcinogens than other cells in deeper layers. Another reason is because epithelial cells tend to have high turnover. They're very quickly falling off and replacing themselves. It's this quick turnover, replication, and cell division process that leaves epithelial cells more prone to mutations that can cause cancers. Now, there's two main types of carcinoma. One is adenocarcinoma. Adeno means gland, so adenocarcinomas develop in glandular cells within organs or glands. These are cells that secrete fluid like mucus or milk, for example. Squamous cell carcinoma is the other type, meaning that it originates from squamous epithelium. Squama means scales, and you can see in this image that stratified squamous epithelium takes the shape of something like fish scales under a microscope. Now let's look at some carcinoma examples. Ductal cells are epithelial cells in the breast that line the milk ducts where milk is secreted. And neoplasms in these cells are a common cause of breast cancer. Now, if you want, go ahead and pause the video and ask yourself if this would be an adenocarcinoma or a squamous cell carcinoma. It's an adenocarcinoma because these cells are glandular cells which are secreting milk. Great job. Now let's look at two types of a lung carcinoma. One of the types of non-small cell lung cancer is an adenocarcinoma, which originates in mucus-producing epithelial cells in the lung. These commonly originate in epithelial cells lining the alveoli in the lowest part of the respiratory tract. Now, this is why a histological type is a more comprehensive and detailed approach compared to primary site classification. If you just said lung cancer, you wouldn't know much about the likely causes, location, behavior of the cancer, or potential treatments. And even though histological type doesn't tell you everything you need to know, right, you still need to know clinical information about the patient, what stage the cancer is in, and other factors, but it tells you a lot more. So here we have another lung cancer, but it's actually not an adenocarcinoma. It's a squamous cell carcinoma, which originated in the stratified squamous epithelium. This more commonly occurs higher up by the large airways of the respiratory tract. Now let's talk about sarcomas. These are cancers that originate from supportive and connective tissues. Thinking back to that prefix chart, we have osteosarcomas of the bone, fibrosarcomas of fibrous tissues, chondrosarcomas of the cartilage. We have myosarcomas of various types, with leiomyosarcomas being of the smooth muscle, while rhabdomyosarcomas are of the striated muscle. And we also have liposarcomas of fat tissues. Now, you may have heard of mesotheliomas, which can commonly be caused by asbestos inhalation. Even though they have the suffix -oma, these are not benign tumors. In fact, this is an exception. They can also be called mesothelial sarcomas because of their malignant tumors of the membranous lining of body cavities. So this can commonly be the lining of a pleural cavity in the lung or the pericardium of the heart, just as two examples. Now, going back to some of our goals from this video, we wanted to know the difference between a leiomyoma, a leiomyosarcoma, and rhabdomyosarcoma. So leiomyoma is the only benign tumor on this page. Uterine fibroids are an example of these smooth muscle benign tumors. As a side note, a lot of people have the misconception that benign means it's really no big deal. But uterine fibroids, although they may not be cancerous, still need to be treated because they can cause hemorrhaging or other complications. So benign tumors can still absolutely be serious and need medical treatment. Blastomas are malignancies of precursor cells, which are cells that haven't yet matured. These are called blast cells, hence the name blastoma. As you might imagine, these are often, but not always, pediatric cancers. For the most part, blastomas follow the same rules with an anatomical prefix followed by blastoma as a suffix. Some examples are shown here, with retinoblastoma being immature cells in the retina of the eye, while nephro and hepatoblastomas refer to cancers that began in immature cells of the kidney and liver. So this video is just meant to give you a broad toolkit to help you better understand the language that people use to talk or write about cancer. While fundamentally all cancers that I'm aware of can be classified histologically, this video doesn't cover all the histology bases, and it's very broad in general. Lymphomas, leukemias, and myelomas are three big categories that really don't follow the rules of carcinomas, sarcomas, or blastomas. There's Hodgkin's lymphomas, non-Hodgkin's, and many types of subclassifications within each. There's acute and chronic lymphoid and myeloid leukemias, and there's also things like smoldering and multiple myelomas. Also, sometimes if different cell types are involved, it can be a mixed histological type. So adenosquamous would involve both squamous epithelium and glandular cells, and carcinosarcoma would involve both cells of epithelial and connective tissue origin. While histological classification systems tell you some information and useful information, often when people write or talk about cancer, they use more detailed classification systems to describe it. So, for example, breast cancers are typically classified by if they have hormone receptors or HER2 receptors on their cell surface. Other types of lung cancers are classified by certain mutations found in the tumor upon biopsy. You might see letters like KRAS, EGFR, PIK3CA, ALK, or ROS1, which all represents genes tested for in certain lung cancers. And these can help to identify patients that might benefit from genome-targeted therapies, which is information you wouldn't just get from histology. Now, other cancers, despite having underlying histological characteristics, aren't commonly referred to in that way. It could just be named after the scientist who discovered it, or maybe it looked a certain way under a microscope, so they named it that way. And then finally, I think most importantly, we didn't discuss anything about staging, which is one of the most important things to know about a cancer. Histological classifications tend to refer to the site of origin, but a carcinoma in situ, which refers to carcinomas that remain in their original site and is an early stage cancer, would be treated much differently from stage 4 cancer that has spread to other parts of the body. So while learning this histological classification is helpful and can help with understanding the language of cancer, it's really just the tip of the iceberg. So that's all I got. I hope this video was helpful. Take care, everyone.